Hey guys, how's it going? So today we're back with Dr. Han. So he's a GP who focuses on surgery or surgical aspects of dentistry, like extractions and implants and things like that. And I thought it'd be interesting to have a discussion about wisdom teeth because a lot of my patient cohort, they ask commonly, especially the parents, when is a good time to take out the wisdom teeth? Is it essential to take out the wisdom teeth before starting braces and things like that? So I thought we could invite the expert and sort of ask even some of the questions that I had about extracting wisdom teeth. So yeah, without further ado, let's get started. Dr. Han, so regarding wisdom teeth, what would you say, why is it important that you should deal with it, to take them out or leave it? Sort of, what is your standpoint on extracting wisdom teeth?
Yeah.
Let's start with that.
A couple of reasons. One is if it's in a position that's going to prevent proper eruption of wisdom tooth. So for example, if the wisdom teeth are lying down horizontally, or even if it's straight, if there's not enough room for it to erupt fully, then from an oral hygiene perspective, sometimes we do recommend you to have the wisdom teeth removed. Around the wisdom teeth, because they're not fully erupt, you can develop cavities, not only on that wisdom tooth, but that cavity can also affect the tooth in front of it. So that would be another reason. Or third reason is that due to that improper eruption, food particles, bacteria would go under the gum and around the crown, and it can sometimes cause a gum infection. So those would be the reasons why we would recommend.
Right. Also, from the orthodontic perspective, there's, I guess, two main indications for taking out wisdom teeth before. One is if we are treating underbite cases or if we're treating severe overbite and we want to distalize the teeth to the back to gain more space in the front, we may ask you that you remove your wisdom teeth so that you have more space at the back. Second reason is if you're going to go through orthodontic surgery, then it's essential that you remove your lower wisdom teeth at least 6 months prior to the surgery. So yeah, those are the main orthodontic indications. Yeah, the main reasons were the cavities and gum infection and favorability of the position. So in terms of timing, is there a specific time frame that you recommend patients to get their wisdom teeth out?
Not a specific timing, because everyone has a different growth. Some children would develop wisdom teeth a lot earlier than others. So we would quite often monitor it with a panoramic x-ray, which is a full mouth x-ray, to see what the development of the crown and the roots of the wisdom teeth are like.
I guess it's a question that I was curious about. What would be let's say, the earliest age you could take it out? What if dentally you think the wisdom teeth are ready to come out?
Again, there's no set age, and it also depends on the indication.
Yeah.
Some children sometimes develop pathology around the wisdom teeth, so that could be one indication to remove the wisdom teeth early. Usually, we do recommend getting the wisdom teeth out around the age of 18 or 19. But the earliest age that we can take out the wisdom tooth would be around anywhere between 12 to 15. And that really depends on multiple factors, whether there's any pathology, such as a cyst, or whether the development of wisdom tooth roots, whether they're close to the nerve underneath it. There are two major nerve vessels that run near the wisdom tooth. One is called lingual nerve, another one is called inferior alveolar nerve. Inferior alveolar nerve is the one that's visible on the panoramic or the full mouth x-ray. If the roots look like they are going to be very close to that nerve, then that would be an indication to remove the wisdom tooth early.
I see. And another thing is, if the 12-year-old molar is trying to come in, and 12-year-old molar usually comes in at around age 12, but because of the wisdom tooth that's sort of on top of the 12-year-old molar, it cannot come in, then I usually refer so that they can remove the wisdom tooth so that the tooth can come in properly. So 12 to 15 if early, but usually around 18, 19.
18 and 19, yeah.
Some cases require an additional x-ray. I mean, you talked about panoramic x-ray, but we can take a CBCT, which is a 3D x-ray. What are sort of the indications that would necessitate taking this additional x-ray?
So in majority of the cases, 2D panoramic x-ray would be sufficient in taking out the wisdom teeth. However, in certain cases where the roots are in close proximity or appear to be very close to the nerve, we would assess it further using a 3D x-ray. It helps us to see what the position of the nerve would be in relation to the roots.
So in cases where like the root is really close to the nerve, where it's like actually entangling it, there's a procedure called cronectomy, right? So can you talk about that? Because sometimes patients don't understand why they're leaving the root.
As the primary goal, we do prefer to take out the wisdom teeth in whole, including the crown and the roots. But if the root entangles the nerve, the risk of numbness around the lip and the chin area increases significantly upon removing the wisdom tooth. So in that case, we perform a procedure called cronectomy, as you mentioned. Cronectomy essentially is a procedure where we cut the crown of the wisdom tooth, leaving the roots behind, because roots are the reasons why you can get numbness. So we cut the crown off, leaving the roots well below the level of the bone. And if it's a non-infected, a healthy root, over time the gum and the bone will grow over that remaining root. Everything will heal accordingly. The removal of that remaining roots become less risky.
Right. And a lot of patients ask me, should I take out all my wisdom teeth out at the same time, or is it better to do like one side at a time, or what's your preference, or what do you say to that?
It's a personal preference for sure. So wisdom teeth can be removed either under sleep or under local anesthesia while you're awake. If it's done under sleep, then we prefer not to put patients to sleep twice.
Right.
So in that case, we would remove all 4 wisdom teeth at the same time. But if it's done under local anesthesia, then we give patients 2 options. The main benefit of removing all 4 at the same time is that 1 surgery, 1 swelling and pain, and done and over with.
Yes.
Whereas the main benefit of doing it twice is that you have pain on just one side, so you can use the other side to kind of eat. Downside is that you have pain and swelling twice.
A lot of people ask also about like, should I be put to sleep for this? Like what's the pain level and what's the swelling recovery time? Like the healing aspects of it?
There are some rare cases where they're severely impacted, a very difficult surgery. Sometimes putting patients to sleep might have a benefit.
Right.
But in the majority of the cases, we can have the wisdom tooth removed under local anesthesia. Some patients would have a severe dental anxiety, so that could be another reason why patients can be put to sleep. It's mainly for patients' comfort. But there's obviously drawbacks to putting patients to sleep as well. There's always a risk associated with anesthesia.
Right.
It's an informed decision that the patients need to make before deciding whether to proceed with sleep or doing it while you're awake.
Okay.
But in terms of the actual procedure under local anesthesia, once we do proper freezing, then you don't really feel any pain. Yes, you do feel some pressure, a bit of noise, just like when you fix up the cavities, there's a bit of drilling noise, but that's really all you kind of feel. And we often do recommend patients to bring in earpods, headphones, listen to music or watch the TV whilst the procedure gets done, and that will calm you down a lot.
Right.
So that's what we normally recommend to patients while getting it out under local anesthesia. Now, talking about the recovery, younger you are, the recovery is faster.
Of course.
Also meaning there's less post-operative pain, swelling, and there's less risk of complication. As you get older, the bone around the wisdom tooth also becomes dense, it becomes stiff, whereas when you're young, the bone is soft, elastic. So the actual procedure of removing the wisdom tooth is often a lot smoother, a lot quicker when you're younger compared to taking out the same wisdom tooth on someone who's 40, 50, 60 years old.
Right. Younger you are, the better healing capacity or regenerative potential you have. So yeah, I think that's why. And for orthodontic, people ask me like, I got my wisdom teeth removed, then how long do I have to wait before I come into my braces appointment or Invisalign appointment? So after about a week, usually, I think I would say it's okay. As long as you don't have active bleeding, then you can come in for your regular braces adjustment. Also for Invisalign, of course, you have swelling back there. It's hard to put on your Invisalign. Do not worry. Not wearing it for a week will not kill you. So you can resume your wear after your swelling has gone down and more comfortable to wear your trace. So I think that's a point that I wanted to address to my patients as well. Yeah. So What about like the post-op instructions? Like what are the food restrictions? What should they not do during the time that they're healing and things like that?
Again, the recovery period really depends on the difficulty of the wisdom tooth and how impacted they are. If the wisdom tooth is in a fairly good position, then the wisdom tooth removal can be fairly straightforward, meaning the recovery is going to be a lot quicker. Then there's not going to be much restriction with what you can't eat, what you can eat. Whereas if the wisdom teeth are fully impacted and it's a bit more involved surgery to have the wisdom tooth out, you will have a bit more post-operative pain, swelling, and meaning in those cases we do recommend you to eat cold, soft food. Like it could be things like a rice pudding, fish fillets, mashed potato, smoothies. After about a week, you can resume normal diet.
About a week is the point.
About a
up to
week.
the point.
And same with the swelling.
Yeah.
That's when the first week is when you have swelling. And then from day 7 onwards, the swelling will subside. Things will feel a lot better after about a week.
And if you start eating hard foods like during the time of recovery, it's not fully healed, like our PD sim had 꼬바로. What? How soon did you have it? 당일. So. 아 이렇게 잘라서 자르긴 했는데 잘라서 it went into the extraction socket and can cause infection, right? So if you eat solid foods too quick and you cannot really cleanse it, right? During the time, like you have swelling, you cannot really rinse properly. Like it's not the same, right? You have to baby it for the time being. So recommend colder foods, softer foods. Similar to orthodontics, you know, when you have braces on, in the beginning we tell you to eat softer foods because you're not really used to eating with your brackets on, right? So, and colder foods also help with swelling and pain. Wisdom teeth in Korean is actually called love teeth or 사랑니, so that's kind of cultural differences. I heard in Spanish it's also very different. If you're the lucky one that's not born with any wisdom teeth, good for you. I hope you guys learned a bit about your wisdom teeth and when to take it out, what are the indications and when's a good timing to do that. And if you have any other question regarding your wisdom teeth or anything else, feel free to leave it down in the comments below, and we'll see you guys in the next one.